everyone, and welcome today. Give me a little shout out in the chat if you can hear me. I just want to make sure everything's working. Okay, let's see if I can turn it up a bit. Just going to try to switch my headphones out and see if you guys can hear me better on those. All right, can you guys hear me a little better now? Okay, perfect. Then we'll stick with these headphones. Sorry about that. Okay, good. I'm glad. All right, so if you haven't been here before, just a little orientation to the room. So if you're on your computer, on the right side will be the chat, which it sounds like, looks like a lot of you guys already found. So feel free to type any questions or comments in there throughout the webinar, and I will do my best to try to answer any and all of them. If you're on your phone, the little chat box will be below the slides. And then make sure you guys stay till the end because we do have a special offer for you guys today for joining in. And I'll just wait a couple more minutes for everyone to join, and then we will get started. Debbie, the webinar will be about 20-ish minutes, give or take a little bit. And then, maybe a little bit longer afterwards for any questions or anything like that. But the actual presentation is about 20 minutes. All right, so I'm going to go ahead and get started. Again, if you just joined, if you're on a computer, the chat box will be on the right, and if you're on a phone, it'll be underneath. And feel free to type any questions or comments or anything, and we will answer those the best we can. All right, so I'm going to go ahead and get started. So today we'll be talking about environmental and food allergies, sort of what to know, how you can beat them, everything and anything about them. Funny thing is I actually am having allergies right now as well. So I'm doing a lot of the stuff that I will be talking about for treatment. Okay, so if you haven't met me yet, I am Dr. Berlin Wright. I am a licensed naturopathic doctor in the state of Arizona. I did a 2-year family practice residency at SCNM, which is the naturopathic medical school here in Arizona. I focus on primarily hormonal imbalances. I do a lot with gut health, which definitely, includes allergies within that, mental health conditions, and autoimmune conditions. I always like to address the root cause of health conditions and help the body heal itself, as well as preventing disease. And I really love working with patients just to reach their health goals and look and feel their best. All right, so what we will talk about and what you'll learn today is common and uncommon signs and symptoms of both environmental and food allergies and sensitivities, which will sort of differentiate between that as well. The difference between food allergies and sensitivities, how to test for both of them, and then limitations and inaccuracies of different types of testing, and then some natural treatment options as well. Renee, just want to make sure, can you hear me now? Hopefully so. Okay. Okay, so allergies versus sensitivities. So first we'll talk about allergies. So allergies are technically an IgE immune response in the body. So this is called immunoglobulin E. We have a few different types in our bodies, and IgE is more of a hypersensitivity reaction and a true allergy when you think about what allergies are. Their allergies are an abnormal response from the immune system where it's overreactive. It's an immediate response that usually occurs within seconds to minutes from the exposure. Histamine is released in your body, which is, if you've heard of over-the-counter medications, they're often antihistamine because of that. And it's very common. So over 50 million Americans have allergies. So some examples of an actual allergy, which is the IgE, could be like an anaphylaxis type of reaction to peanuts or some other type of nuts. Seasonal allergies to pollen or to pet dander, cat hair, that kind of thing. Skin allergies that are rashes or hives. If you have a reaction to a medication, that could be an IgE allergy, right? If your doctor asks, what are your medication allergies? That would be that type of allergy. Sometimes insect bites or stings like bee stings or latex allergies as well. All right. Next, we're going to talk a little bit about what sensitivities are. So generally when we talk about sensitivities, it's more related to foods specifically than, pollen or environmental type of things. Sensitivity is an IgG reaction. So this is a different type of immunoglobulin in the body, and it's a delayed reaction. Like I said, it's generally associated more with foods. It triggers inflammation in the body. It's not usually as acute or as serious as an IgE reaction, and it can occur actually up to 72 hours after the exposure, which is what makes it sort of tricky. And then food sensitivity and intolerance are sometimes used interchangeably, those words, but an actual intolerance, the actual definition is if you have difficulty digesting foods due to the lack or deficiency of an actual enzyme needed to break it down. So for example, with lactose intolerance, you don't have the enzymes needed to break down the lactose in the milk, and so that's an actual food intolerance. These are just some stats that I thought I would throw up here, just because allergies are so common. So many people experience them, and you don't have to suffer from them as much as everyone does. And so 1 in 5 Americans have been diagnosed with allergies. People miss so much work actually due to allergies, and there's a lot of money that goes into them as well. Most people, more than 50%, say that they impact their daily quality of life when they have them. And then talks a little bit about asthma patients. At least 2/3 of asthma patients have environmental allergies, and it worsens your, symptoms of asthma. And then this just talks a little bit about genetics. So if you have a parent with allergies, it increases your risk as a child to have them. And then if you have 2 parents, it even increases it more. So very prevalent, super bothersome, especially in the springtime right now, where we are. All right, so some most common allergens, and this is more specific to Arizona, although can be in other states as well, in other places of the world. But in Arizona, dust is a big one. It's very dusty here. Weeds, ragweed is probably the most common one that causes issues for people. Lots of different trees and all the flowers and pollens and all of that. Different types of grasses. This might be, a little bit more bothersome in other places where there's more grass, but we still have some here, especially in the summers. Mold is a big one. Pollution, cigarette smoke can be a bother for some people. And environmental allergies can be year-round, right? If it's, mold or pollution or stuff like that, it can be year-round, but a lot of people notice them more seasonally. So worse in the spring, or sometimes in Arizona late summer, when we sort of have another blossom. All right. So the common symptoms of environmental allergies, most people have probably experienced some of these at some point in their life. So a lot of sneezing, watery or red eyes. You can have hives or rashes, runny nose with congestion, itchy ears, eyes, nose, throat, really itchy everywhere, skin. You can have some postnasal drip in the back of your throat, which can sometimes lead to a little bit of a sore throat just from that. Sometimes headaches, and then cough or shortness of breath, or sometimes wheezing, especially if you have, asthma or a history of lung stuff, that could make that worse. And then this was just a funny little cartoon I found. It's a little bee and the doctor's saying, "Bad news, you're allergic to pollen." Wouldn't go very well for them. All right, so some common food allergies and sensitivities. These are definitely, not the only ones that can happen, but the most common ones that we see. So gluten and wheat is a big one, dairy, eggs, soy, yeast, peanuts, and other tree nuts, fish, and shellfish. So we see these pretty frequently as both food allergies and sensitivities. And I would say everyone is different, right? Everyone's unique and their makeup is a little bit different. So people are reactive to different types of foods. Everyone is different. And usually it's not all of these for each person. It's usually, a select few, maybe 2 or 3. So it just depends. All right, so some common and uncommon symptoms of food allergies and sensitivities. So most common symptoms that people probably think about are abdominal pain, maybe some indigestion, heartburn. You can definitely get nausea or vomiting, maybe if it's really bad, diarrhea, constipation. I think a lot of people notice this with maybe some dairy. They might eat some dairy or some cheese and they're like, yeah, I sort of had weird stools, or they were a little off. Bloating and gas can definitely happen. Hives and rashes. You can still have watery, itchy, and red eyes, eye symptoms, runny nose. And then more for anaphylactic type of things, you can have swelling of the mouth, lips, throat, and tongue. Difficulty breathing or speaking. And then, if it's really severe, you can have decreased heart rate and even loss of consciousness. And like I said, those are more like IgE, allergies, anaphylactic type of reactions. All right. And then more of some uncommon symptoms that you might not actually have, known could be caused by foods, which I really love to talk about these because so many people have some of these symptoms and just don't know that it could be from foods that you're eating that are causing inflammation in your body. So headaches, this actually was a big one for me. When I was in high school, I had headaches almost every day, and I didn't know why. I thought, maybe it's stress, maybe it's something else. And I actually ended up cutting out dairy, and my headaches basically went away. And that's not the case for everyone, but that's just what was my trigger. That's what was causing inflammation for me. So big on headaches, feeling just tired overall, not like yourself, sort of sluggish. Joint pain, this is also a huge one. I've had many patients who have had joint pain in like knees, hips, fingers, feet, literally everywhere. And they cut out, said food sensitivity. Sometimes it could be gluten or other things. And they're like, yeah, my joint pain is just so much better now. So it's really just that inflammation that it's causing in your body. Brain fog or difficulty concentrating, poor immune function. So maybe you're getting sick a lot and you don't know why, and that could be contributing. Acne has a lot to do with gut health, and if there's inflammation or leaky gut, which we'll talk about in a little bit, that could definitely be causing or contributing to some acne. Difficulty sleeping, chest tightness, I've had multiple people say, some mood changes, so anxiety, depression, maybe even some irritability, sinus congestion, which I guess maybe this could be more of a common symptom, but I think dairy, there's other foods, but oftentimes dairy is a big culprit of causing congestion. And so I just like to mention that one because it's so common. And then also urinary irritation, urgency, frequency, that kind of stuff sometimes can actually be either triggered by or worsened by food sensitivities. Alrighty, so testing and diagnosis. So there's a few different ways. So a skin prick or scratch test is probably the most common conventional testing that is done. This is actually best for IgE allergies. So again, those true allergies. You can do it for both environmental or foods. Usually this is done by an allergist. And so this picture over here with the back, that's usually what it looks like. Sometimes they do it on your arm or on your back, and they'll, prick your little skin with some of the pollens or whatever they're testing and see what type of reaction comes up. It's not, maybe the most pleasant, but generally it's a pretty safe way to do that type of testing, and can be, relatively accurate. So you can also do a blood test. This is going to be a finger stick, so just on the tip of your finger and get a few drops of blood, or actual blood draw from, like your vein like you normally would. And those are best for food sensitivities, so more of an IgE or IgG type of reaction, delayed sensitivity. These are generally cash pay, unfortunately. Hopefully one day insurance might cover them, but right now they're cash pay labs. And you can also add an IgE testing if you're doing this at the same time. But this is a great way to do that. And in our office, we do offer both types of the blood tests, so both the finger stick and the blood draw. And then another option is an elimination diet. So an elimination diet is something that you can do for food sensitivities. So you can eliminate the most common food sensitivities or inflammatory foods that are known to cause reactions in most people. And then usually you do that for, a few weeks, a couple months, something like that. And then you would reintroduce foods one at a time. Usually when you do this, your original diet is pretty restrictive because you're trying to make sure that anything you're eating is not going to be causing inflammation or issues in your body. And then you'll reintroduce them one at a time and see if there's any type of reaction. So those could be, any of the symptoms we mentioned before. So maybe some abdominal symptoms, some bloating and gas, or maybe some headaches or congestion or joint pain. So it could be any of that you're sort of keeping an eye on. And this is a great way because it's, your body and listening to your body and what it's showing, but it does take a good amount of effort and it can take time as well. So those are sort of the ways that we test and diagnose things. So some limitations for testing. Limitations for food sensitivity testing. So it's more complicated than just looking at what comes up positive on these tests. In a couple slides, I'll just give an example of what a food sensitivity panel test result looks like. So you can see that. But sometimes when it comes up positive, there's more that goes into it than just saying it's just positive and that's that. The tests that they send to your house that you can do, it's awesome that, more people can access this stuff and this information. But if you're doing those type of tests, it's always best to have a licensed professional at least review the results with you so that there's an accurate interpretation of what's actually going on and your symptoms and what all of that means together. There can be cross-reactivity between certain type of allergens. So sometimes if something comes up positive, maybe it's not actually that is the issue, but it was something like, pet hair that caused this to react, or, different types of pollens or latex or different things like that caused a positive food sensitivity test. And so it's just important to be aware of those when you're going through results. They're not always 100% accurate. I don't know that we can say for certainty that any test is 100% accurate, but I do see very good results when I do food sensitivity testing, but they're not 100%. Food sensitivities can also change over time. And it's best to eat the tested foods prior to testing, basically to make sure that they're in your body. And so if your body is going to react to it, it will, and then it'll come up on the test. If you haven't been eating, gluten or something for weeks to months to years, it's not in your body, it's not in the system. So it might be more challenging for it to react to that at that point. And then leaky gut. So probably a lot of people have heard about leaky gut just around. So leaky gut is actually also known as increased intestinal permeability. So this is where your gut lining gets a little bit leaky. And so it develops over time with continued consumption of food sensitivities or allergies that are causing inflammation in the gut lining. And then particles can actually get through the gut lining into the bloodstream that are not supposed to be there. And that's generally actually what causes some of these other symptoms like the headache and brain fog and joint pain and that kind of stuff. So the way I like to explain it is actually your gut lining is like I don't know if you guys can see this, but like your fingers, like your knuckles, if you put them right next to each other, there shouldn't be any gaps, right? And so if you eat a bunch of foods that are causing issues over time, it's going to actually increase that space between your joints or your gut lining. And then foods or other particles can get in between when they're not supposed to be there. So part of what we do, which we'll talk about treatment, is try to heal that up so that can't happen anymore. Leaky gut can also cause false positives on food sensitivity testing. And so it's just important to keep that in mind as a practitioner when you're reviewing the tests. All right. And again, if you guys have any questions or anything, feel free to drop them in the questions or chat and we will get back to you. So like I said, this is a food sensitivity test, so it's like a sample report. And the ones that we do generally can test for 96 or 184 food sensitivities. On this one, so anything that came up red is considered a food sensitivity. And then anything that's black was not. It was negative, non-reactive. On this one, they are ranked by reaction from a 0 to a 3, 3 being the worst and 0 being non-reactive. So let's see what came up on this one. So egg whites came up, some random ones, yeast, pineapple. So this is a pretty, good amount, but definitely not uncommon that I see quite a few food sensitivities. And like I said, the most common ones that I see are definitely going to be eggs, dairy, gluten, yeast pretty commonly, and some of the nuts as well. And then I think a lot of people, are unsure if they want to do food sensitivity testing because they think it means you're going to have to cut everything out forever and you can never eat any, good food ever again. So I just put this funny little cartoon that I found that he's at a pizza place and it says, "I'm lactose intolerant, gluten intolerant, vegan, and allergic to tomatoes." What have you got that's good? So I thought that was funny. And, initially we might want to follow a more strict diet based off of your test results, which may be dairy-free and gluten-free. Not for everyone, but it might be. But generally that's not, it doesn't necessarily mean it's forever that you have to do that. And we would discuss that and figure that out, once you do that test and we consult on it. So some treatment stuff. So conventional treatment options are really over-the-counter allergy medications like Claritin, Zyrtec. Some people might have used Benadryl for these type of reactions. Steroids can be used if it's really severe, like if you have some sort of, lung symptom like wheezing or a rash that won't go away due to some type of allergy. Sometimes they'll use steroids. And then allergy shots, which is also called immunotherapy. So this is really trying to build up a tolerance in your body so that you're, a desensitization in your body so that your body doesn't react to it the same way. Usually allergists do this in their office. And I will also note that if you have an IgE, an anaphylactic reaction, it's very important to have an EpiPen in case of emergencies. There's no natural treatment for this. That is what you need to do in that situation. So some other things for treatment. So limiting exposure to those allergens, whether that's food, the pollens, pets. It's not always that easy, but as much as you can to avoid it. Decreasing inflammation is going to help. So with diet and lifestyle, there's different supplements that can help as well. And then opening up detox pathways in the body. So making sure you're having regular bowel movements and drinking enough water, being active, sweating, whether that's with exercise or sauna, moving lymph flow, and then breathing also, just because your lungs can help detox. And so focusing on your breath. So all of these things are important because if you have an allergy buildup in your body, you've got to get it out somehow, right? And so these are all the ways that we can help to get rid of it, basically. So some natural treatment options for environmental allergies. So again, limiting exposure. So if you know that you have really bad seasonal allergies this time of year, maybe making sure your windows are closed. If you have a pet allergy, but you have pets at home, make sure to keep them off of your furniture or your bed. Cleaning regularly, all those little things will help. You can always get an air filter to put in your house in certain rooms, and that can be very helpful, especially with like dust and pollens and that kind of stuff. Neti pots are great. So this is like a nasal irrigation system, and it helps to clear out the sinuses, which can help clean out any pollen that's in there or any like allergens that get in there, and also can help with like congestion and those type of symptoms. If you do use a neti pot or anything like that, make sure you're using distilled water or saline. Don't ever use normal tap water. Vitamin C can be a great addition. It's a great antioxidant, can help with the histamine response. NAC seems like it's great for everything, but it helps with congestion and supporting the lungs. So that's a great option as well. And then DHIS, this is one of our favorite supplements, actually. It's a great natural antihistamine and anti-inflammatory. We probably recommend this, more than almost anything else, because it just can work so well. And so really love that one. I'm actually, like I said, I have some allergies right now, and I'm actually doing all of those things. And then antioxidants overall are great. You can get those in supplements or in foods. And then the other thing we do offer here is called sublingual immunotherapy. This is also called SLIT. So this is what the picture is of, actually. There are, multiple companies, but the company we use is called Allergies. So this is what it looks like. And basically it's a retraining or desensitization therapy where you use these little drops every day, giving your body just a little dose of it, so that it can, desensitize to it, so that you don't have the same type of reaction. And that can work really well for a lot of people. It does take a little bit longer. It's not like a week type of therapy or as needed, because it takes time for your body to desensitize to that. All right. Okay, so then for food sensitivities, you can do an elimination diet. So generally what we would do is run those food sensitivity testing, and then based off of those results, we would probably avoid food sensitivities for anywhere from 4 to 8 weeks, depends on the person and what's going on. And in that time, we would want to make sure we're healing the gut as well. So there's different ways to do that, different supplements, different nutrients, things that can help. You want to help decrease inflammation in your gut, so in the stomach lining, all the way down, and soothing the lining. So we often use things called demulcents that help to coat the gut lining, and really just soothe it, decrease the inflammation and the irritation. And then you also want to promote healing within the gut. So like I said, those, they're called gap junctions in your gut lining, so they can go back together. And so food or different particles can't get through anymore. Things that can help with this is a collagen powder or even a bone broth. Those can be very helpful in this whole healing process. Glutamine, which is a great amino acid, can be helpful for healing the gut. There's also many gut healing powders that are specifically formulated with, usually they have glutamine, maybe some other things, vitamins or herbs, things like that, that help to heal the gut lining. I didn't write it on here, but aloe is also a really nice soothing one. You can get aloe juice. Just make sure you're not getting the gel, because that can cause diarrhea, which we don't want. So the juice can be very soothing as well. Zinc is good. Probiotics are always great to make sure that the microbiome is in check. And then, like I said, herbs that are anti-inflammatory can coat the gut and protect the lining. So those are sort of the basic treatment things that we would do if we ran a food sensitivity test and then went forward from there. And Tracy, for DHIST, we do have some here in the office. And then I don't know where else you would be able to find it. It's more of like a practitioner type of product. So I don't think most grocery stores sell it, but we do have some here in the office. And then, yeah, that's the best place I know to get it. All right, so special offer. We're super excited to be offering a special promotion for anyone who registered for the webinar today. And it's a 96 IgG food allergy panel, so similar to the result that I showed you guys. It would be, you would get that test plus a 45-minute consultation afterwards to review the results together for $399. Which is actually over $50 in savings. And so it's a great deal. You don't have to be an established patient. And if you are not an established patient already, you don't have to do the full new patient intake before doing this. So it's a really great deal, and it's really good just to get in check and see, where your gut's at, where your inflammation is at, and what you can do to help support that. Dana, I hope I'm saying that right. DHIST is not prescription, so we don't need to write a prescription. I just haven't really seen it at like Sprouts or health food stores. They might have it on Amazon, but Amazon sometimes is not the most reliable with its supplements, and we just want to make sure that you're actually getting what it's supposed to be. Oh, and then yes, FullScript is a great way also. And so if you don't live close or it's just easier to get it shipped to your house, we can always send you a link on FullScript. So those are some good options for you. Any questions that came up? Just want to make sure didn't miss any questions. No? Alrighty. Well, that is what I have for you guys today. And this is our information. So if you guys are interested in, taking on that food sensitivity test and taking full advantage of that offer, you can just give us a call. Our phone number is listed right here. It's 480-361-5188. And we can get you scheduled for that. We also, like I said, do have the DHIST in stock here, and then also on FullScript, as well as some other supplements like the NAC and the vitamin C, all that kind of stuff. So I think that is it, and I will leave it on this screen just in case you guys need our phone number or our information. And thank you guys so much for joining today. I hope this was helpful, and hopefully we'll see your shining faces in here. Amy, I believe it is recorded, so yes, you should be able to rewatch it. I'll stay on just for a couple minutes in case anyone has questions, but you guys are welcome to jump off. So thank you again and have a great day.